Jennifer Dimick is going to talk about the psychosocial aspects of bladder cancer for veterans. Jennifer is an outpatient social worker with the Louis Stokes Cleveland VA Medical Center in Cleveland, Ohio. She works in the Department of Hematology Oncology.
Veterans are a different group of people who are a part of our population. They're protectors. They protect our country, they protect our families, and when they're diagnosed with a cancer, this can make them feel like they're not quite the protector that they were. Puts a little ding in their armor. And so anger can come about because of that. Many veterans have expressed anger about the government because of being drafted into war, or we have our Marines at Camp Lejeune who feel that they themselves and their families have been exposed to toxins because of the government. When you're struggling with anger and you've been diagnosed with cancer, that can interfere with the diagnosis and the treatment of cancer. Sometimes the anger and irritability, you don't have the coping mechanism to wait for your appointment, or it's not scheduled at the right time, and that can interfere with the diagnostic screening or even the treatment of your cancer. It also can cause problems within your family, with your relationship with your wife or significant other, because you may not talk about your anger. You may push down your anger and not communicate effectively, which will cause some discord between you and your loved one. And anger is an ineffective coping skill, though it is something that everyone deals with. It's a valid emotion, but it's not an effective way of coping with the uncertainty of bladder cancer. So we have ways to help with those sort of feelings. Now there's being more studies done on the effects of cancer with people with PTSD, and the studies are showing that symptoms of PTSD can increase during cancer treatment. So we're finding that veterans are experiencing more of those nightmares and anxiety and such when they have to go into cancer treatment. And certainly we have a large portion of veterans who have issues with substance abuse, and then when they're having difficulty with the anger that they're feeling about this cancer diagnosis, that could lead to an increase in substance abuse. And depression and anxiety certainly can increase as well with getting a cancer diagnosis. Ways that can help you in coping with a cancer diagnosis is getting the education on the diagnosis itself, which tuning into Beacon and going on the webinars in their website is a perfect way to find out about bladder cancer and link up with other people who are going through it as well. So that will make the what ifs of what your treatment plan may be less threatening, because you will know about it in advance, what can happen. And then having your family and your friends around you as you go through this treatment is also a good way of getting support. Certainly having your family come with you to appointments, we always recommend that. Finding another person who can listen so that you can go over it with them after your appointments is always a good idea. And then you can talk to your healthcare team and get as much information from the team. We have a wide variety of people who can help within oncology itself. There are the oncologists and nurse practitioners and nurses and psychologists and psychiatrists who are specialized with cancer and certainly social work. There's a wide variety of people that can help you through that. And you can always ask for a referral to the social worker or to a mental health provider so that we can link you up with services that you may need as you're going through your treatment. And then I always recommend to anyone who's going through treatment a power of attorney for healthcare and living well, because that is the way for you to put your medical wishes on paper so that your doctors will know what type of treatment you would like to have in the future if you were not able to tell them. So these are some of the VA resources. We have the multidisciplinary team, which I just spoke about, that can coordinate care. And we have patient navigators as part of the team. We have just a variety of people that can help. And the VA has a centralized record system. Our medical record system can be viewed at other VAs in the country. And so if you wanted to relocate, we can assist in getting your records to be able to be viewed in your next location. And we also help with setting up your appointments and things in your next location that you're going to. So that makes things much easier. It's not like you're going outside of a system. And then our VA centers are staffed by leading experts affiliated with major research universities. As like Dr. Taylor is with Baylor, and in Cleveland here we are affiliated with Case Western Reserve. So you have very expert doctors and nurses, social workers that are all come from major universities. And then one of the very important resources that we have is smoking cessation. And the VA really does have a lot of smoking cessation ways, such as the replacement products, the support group. Our psychologists are trained in smoking cessation, so if you are interested in quitting smoking, you can speak with your healthcare team. They can put in a consult for you to then meet with someone to go over smoking cessation. We also have support groups, various different types. We have caregiver support groups where you could call in by telephone. We have, certainly PTSD support groups. We have cancer support groups. And you can just ask your oncology team. If the doctors themselves don't know off the top of their heads, ask to speak to the social worker, and the social worker can tell you what support groups are available. And then we also have nutrition consultation, and so that was a member of the team that I neglected to mention. We always have a nutritionist on staff, and that she or he can meet with you before or after surgery, and certainly always when you are going through chemotherapy. These are just some of the places where you can go to web links or by calling on the phone if you'd like to do it that way, but certainly you can also talk to your providers at the VA and they can link you up for the smoking cessation groups.